Thank you, Don. It's a real thrill for me to be here. You know, as a young child, I grew up in Chicago. I was born in Gary, Indiana. I grew up in Chicago, and as a Boy Scout, I went to Cantini, and Colonel McCormick was one of my heroes. We went on a hike that day. We got a nice little medal for the hike. We crawled all over the museum and the tanks and the artillery. And I have to say that as a young child, that was part of my inspiration to go to West Point. So I have great fondness in my heart for Colonel McCormick, the McCormick Foundation, and everything that that Colonel McCormick represents for all of us. Here's a little known fact. My department, the Department of Veterans Affairs, is what is today of joining forces. It's true. Back in January of 1946, my predecessor, General Omar Bradley, issued Policy Memorandum Number 2, which was all about joining forces. The memo established partnerships between Veterans Administration and medical schools across the country. These partnerships had a threefold purpose. First was to give veterans the highest quality medical care they could get anywhere. Second, to give veterans the opportunity for postgraduate study. And third was to raise the general standard of medical practice in the United States by using VA facilities to train medical professionals. In other words, the memo created what we call today a three-legged stool. It's a three-legged stool of VA care. Its benefits not just veterans, but also all Americans. We talk about our health system as the canary in the coal mine. We see problems in the American health system before the general public does, and we try to fix them. The first leg of the stool is research. Through VA research, it leads to major breakthroughs that have resulted in 3 Nobel Prizes, 7 Lasker Awards. We did the first liver transplant. We did the first implantable pacemaker. It was VA doctors who invented the shingles vaccine. It was a VA nurse who came up with the idea of using a barcode to connect patients with medicines, with medical records. VA's got one of the first electronic medical records, and I could go on and on. So that research not only benefits veterans, but it benefits the American public. The second leg of the stool is training. Did you know that VA trains 70% of all the doctors in this country through our residency program? Did you also know that VA is the largest employer of nurses in our country and has training programs to train nurses? The third leg of the stool is, of course, our highly specialized clinical work. We have the very best doctors, but also the very best patients in the country. Today, VA partners with over 1,900 academic and research institutions nationwide. And without their contributions, healthcare today in America would not be what it is. That's why both veterans and the nation need the VA. In the past 9 months, to meet the rising demand for medical care, we've extended hours, increased authorizations for non-VA care, or what we call care in the community, and hired more doctors and more nurses. As a result, we're completing 97% of appointments within 30 days of the veteran's preferred date. We're completing 20% as same-day appointments, and 22% of those are completed by non-VA providers. We complete 500,000 mental health appointments each month with an average wait time of about 3 days. And we've reduced our electronic wait list by more than 55%. With the President's requested budget, we'll be able to make the most of our partnerships and to make sure veterans get the care that they need and have already earned. But we need the House and the Senate to get on board and provide us the necessary funding. Remember, health care is just one of VA nine lines of business. Our other lines include life insurance, mortgage insurance, education, pensions, disability compensation, and memorial affairs. Now, we've got some reasons to be proud of some of those areas as well. We've cut the disability claims backlog by more than 70% in the past 2 years. We guarantee 2 million home loans with the lowest foreclosure rate and the highest satisfaction rate in the mortgage industry. For the past decade, the American Customer Satisfaction Index has ranked our cemetery system as the top customer service organization in the nation, public or private. And since 2004, the same index has also shown that veterans give VA healthcare higher ratings than patients at most private sector hospitals. 1/3 of VA employees are veterans. And with the right strategies and support, there's no reason why we can't scale that performance excellence across the entire VA. 1/3 of VA employees are veterans, but what was true in 1946 is still true today. We can't serve veterans the way they deserve to be served without public and private partnerships. I've been at the VA for 9 months now, and I've spent much of that time on the road visiting VA facilities. Everywhere I go, I find philanthropy in action, serving veterans. Last month, I was in Palo Alto, where I toured the Defenders Lodge, funded by my friends, Lee and Penny Anderson, and the PenFen Foundation, where veterans and their caregivers can stay for free while being treated at the Palo Alto VA Medical Center. In March, I was in Colorado for our annual winter sports clinic, where I was able to ski down Snowmass Hill with paralyzed veterans. This was sponsored by the Disabled American Veterans and a host of corporate donors, including Ford, Samsung, Prudential, Cisco, and many others. In January, I was in Chicago for a roundtable on an innovative program to get veterans working in the natural gas industry. It was sponsored by Chicago's city colleges, the Utility Workers Union, and the local utility, People's Gas. And last October, as Don suggested, I was in Kansas City for the World Series game dedicated to veterans. And before the game, I was shown what was renovated and brought back to life as a VA hospital annex, an old building that became one of the newest and most beautiful annexes through the generosity of the Kansas City Royals, the Bank of America, and Major League Baseball. The point is, there are plenty of opportunities for foundations and corporations to help out. They can help out with existing projects, with projects all your own, projects you can put a name on to say we did this for America's veterans and their families. Many of you here today have already stepped up to the plate to help veterans, and with your help, we've made great progress. We've made progress helping veterans find jobs, providing mental health services they need, and ending veterans' homelessness. Veterans' homelessness is down 33% since 2010, and you'll be hearing more about this later this morning. I am extremely grateful for all of your help, but I want you to know that we're working to make partnerships with VA both easier and more effective. We've made it a strategic priority. We've stood up an Office of Strategic Partnerships under Matt Collier. Matt, if you don't mind standing. Matt works with Doug Carmen and Maggie Kragniski, as well as many others. In Omar Bradley's day, a lot could be done with a handshake. Nowadays, things are a bit more complicated. But we have a lot to do, and we have a lot to be a lot more careful about, such things as information security, federal acquisition regulations, and many other restraints. But we're committed to making the most of our partnerships through a number of process improvements. We're working on clarifying current policies and streamlining procedures wherever possible. We're evaluating and benchmarking existing partnerships. And we're also conducting a gap analysis to identify areas of greatest need and opportunities for collaboration. We want to do more together in the future and not less. No question about it. Strategic partnerships are incredibly important to our future. And we welcome your advice and your assistance in making that happen. Thanks again for all you already do. Thanks also to the Council on Foundations and the Veterans Philanthropy Exchange for hosting this event. And of course, special thanks to First Lady Michelle Obama, Dr. Joe Biden, and the staff of the White House Joining Forces initiative. Your commitment to caring for those who have borne the battle and for their families and survivors is deeply touching and much appreciated by everyone. Thank you very much.